Joining me live now is Australian Medical Association President Dr. Danielle McMullen. Dr. McMullen, thank you for coming on the show. You've said that it's welcome that we are getting this additional funding, but a lot more structural reform is needed. Can you tell us more?
Yeah, so we're so glad a deal was struck yesterday because a no deal would have been disastrous for our public hospital system. This funding and the 5-year timeline gives our public hospitals that certainty they need about funding to be able to continue delivering care to Australians. But the work's not done yet. We now need our state and territory governments and our Commonwealth government to really work collaboratively on, okay, how do we use this funding to its best possible benefit, make sure that people are getting off of ambulances into emergency departments, getting their planned surgery, and importantly, being able to be discharged home with supports when they're ready to go home.
So how will patients actually feel that funding boost? As you mentioned, the ambulance ramping and the very long wait lists for surgery. How soon can they feel that?
We're expecting this quantum of funding it plays catch up from the shortfall that the Commonwealth had over the past few years, and it stabilises the performance of our hospitals. We do think more work needs to be done to improve that performance so that patients see a real difference. I think the main thing we'll see is that at least things will not get worse over the next few months, but I certainly hope that we're working hard to get them better.
And the AMA is actually calling for a 45% of the Commonwealth funding share. How far off are we? Can we get there?
The Commonwealth did stick, we stuck to their promise of 45% of funding by 2035. We had hoped they would bring that forward to 2030, but at least they found that funding to meet their original promise. And so now really it is about how we implement that funding. We've got a lot of work to do in aged care to make sure that people can be discharged home or to aged care with appropriate supports. And getting our elective surgeries back on track, outpatient appointments, and making sure patients can really get that healthcare when they're so unwell.
What next for structural reforms in the public hospital space?
We'd really like to see what each state and territory comes up with to match the funding from the Commonwealth and initiatives that are really sustainable to drive that innovation in our public hospitals, to get better integration with general practice, make sure it's smoother for patients who need to get into hospital. And as I said, that cooperation, particularly around aged care and disability between the Commonwealth and the states and territories, so that once people are well enough to go home and they're better cared for at home but need some extra supports, we've got those supports ready to go.
Do you think this is just a stopgap? We're going to see more need for funding in terms of aged care and maybe mental health services. How much is going to be enough? And is it a matter of also, working smarter?
Yes, this does provide some certainty to hospitals for the next 5 years, which is really critical. So we do applaud both state and territory and Commonwealth governments for coming to the agreement yesterday. But certainly more cooperation and more work is going to be needed. We're seeing year-on-year increases in demand. We've got an ageing population, more chronic disease, so our hospitals are under more and more pressure every year, and we've got to find a way to keep up with that activity, and that means more preventive health, so we've got less people needing hospital, better coordination with general practice so that it's clearer when people need to be in hospital and when we as GPs can look after them. And of course, as you mentioned, aged care and disability so that people, when they're well enough, can go home. And all of that work frees up our hospitals in the middle of that care to provide the most urgent, acute, serious healthcare that our healthcare system provides.
So do you think by 2030 that logjam would have disappeared?
I would like to say so. Time will tell, and we'll see as the details of these the funding announcements yesterday roll out, but we would hope that we see an improvement in the performance and steps out of this logjam that we're in at the moment by 2030, and certainly hopefully by 2035 if we can keep this level of cooperation up.
Thank you so much for your time. Enjoyed the insights.